Hi, today we have Dr. Teresa Sievers here with us, and we're going to be talking about arthritis, and in specific is palindromic arthritis, but what causes, or the causes of palindromic arthritis, because there's a lot of people that may have been diagnosed with it and don't know what it is. They had their doctor tell them, this is what you have, and they're going home to Google it or want to know more information. And that's what you are here for.
That's right. So palindromic arthritis just means it's a recurrent form of arthritis. Typically we're referring to rheumatoid arthritis, which is a recurrent arthritis, and it is of an autoimmune cause, which means that the body is creating antibodies that are going against its own tissue and it's breaking it down the same way the body would try to fight infection. It can be extremely debilitating. It generally is always going to have hand involvement, and it's usually symmetrical. It's not always both knees or both feet, but you're going to have some component where both of your hands are bothering you, both of your wrists bother you, both of your feet bother you, or maybe one foot, but at some component it's going to be both sides. And the joint gets very tender, red, and swollen, and that autoimmune process that's going on is actually destroying the joint, and something needs to be done.
Now, is that something that you just get from like a bad diet or bad eating, or it just kind of springs up on you and all of a sudden you wake up one morning you have that type of arthritis?
Yeah. We really don't know for sure, but we know that there is definitely a genetic component. We've been able to isolate that. And whether or not those genes get turned on are going to be determined by things such as lifestyle, diet, those sorts of things, and particularly your gastrointestinal health. Like all autoimmune illnesses, we say in functional medicine, originate in there.
Okay, and I notice you have a lot of supplements. You carry a lot of supplements. You have omega here and fish oil and garlic, so you're really big on that. And what would you recommend for someone that's like maybe doesn't want to try the drug route and go on drugs? They want to try something natural.
Yeah, and especially early on. Sometimes people have a very mild case of it.
Sure.
So they don't need to be using big guns. I will use this product, which actually the whole reason the product exists is because the person who patented the extraction process for the main ingredient, the cetyl myristoyl, or CM8, he was developed in 1977, and he developed it because his neighbor had severe rheumatoid. He was a doctor, a researcher at the National Institutes of Health, so pretty big laboratory, and he was frustrated that there was nothing to really treat it, and the treatments out, particularly at that time, were even worse than what we have now. And he created his own lab, and with lots of trial and error and chemistry cooking, he isolated this component and found that it helped not only for the rheumatoid, but it also helped him years later when he had osteoarthritis, and that's where it was birthed as a supplement.
That's great. And then you can take like 2 capsules a day for like the load up?
Yeah, for an acute situation, I would probably I would use the joint loading, and I would do 2 tablets 3 times a day for about 2 weeks, and then they can cut back to twice a day. I encourage patients to really watch the sugar, particularly the carbonated beverages like the soda, limit their caffeine intake, watch the sugary foods in general. And
well, that's not good in general.
It's not good in general, of course. It's gonna cause more inflammation in the body. And the CM8 will really help calm down the immune system. As I was saying earlier, when you have this sort of an arthritis, the immune system is actually destroying the joint, and if you don't step in, the joint will destroy to the point that it doesn't return.
Right.
And that's serious. So we need a component that's going to do that, and all the other products that are out there are not turning off the immune system enough.
Okay, well, good. Yeah. Well, I'm glad you are providing that type of information. All this stuff about cetyl myristoyl and all those other ingredients, you could always research them and find out more about them. But
email us.
Email us or whatever. But thank you, Dr. Teresa Sievers.
Thank you.
And stay tuned.